District Hospital South Goa lacks services for the last 2 years. Like me, some of them, we have our own system.
Yeah.
हमको ॲम्ब्युलन्स आहे, आमको हें आहे, हर्सफॅन आहे, आमको जात नाही. हांव असेंब्ली उलयतां सावथ गोवा हॉस्पिटल म्हणटा आमगे बरें जावपा जाय. सी दॅट द गव्हर्मेंट गिव्स मोर ॲम्ब्युलन्सीस, more facilities at district hospital. Write a letter tomorrow itself to the minister.
Sir, just 2 days back, a resident from Madagaon met with the accident and lost his life due to the non-availability of ambulance and advanced health care facility at South Goa District Hospital. As a MLA, what do you want to say on that?
कितें आहा थिंगा आमी people MLAs like me, some of them, we have our own system.
Yeah.
आमको ॲम्ब्युलन्स आहे, आमको हें आहे, हर्सफॅन आहे, आमको जात नाही कोत्ताय. बाकी गव्हर्मेंटान करपा जाय. So must find out why they should check why at that time there was no ambulance at that time. What was the reason? And what is the reason why people should be kept for a want of ambulance? The second thing is we have always been discussing in the assembly की आणि हांव assembly उलयतां सावथ गोवा हॉस्पिटल म्हणटा आमगे बरें जावपा जाय कित्याक people from काणकोण come all the way to district hospital, and when they come to district hospital there is nothing more, so much time is wasted once they reach GMC. Therefore I feel that there should be proper ambulances, proper things there. Otherwise, I feel that we should take the people to task who are there. So I think first we'll have to assess what was the reason that the ambulance had gone to Panjim and come back. Oh, why? What was the reason? And I feel that we should increase the number of ambulances there and give more service to the people, because ultimately what has happened is my sister also died in an accident. There is no emergency system there, even my sister. So I know what it is. So it is but necessary that we have to put stress on it. This is just an eye opener. I think we should see that the government gives more ambulances, more facilities at district hospital.
Sir, you will speak to the CM or the head minister on that.
Write a letter tomorrow itself to the minister.
Okay. So
I'll not waste time. I'll give you the copy also. I'll write to them and see what has happened and what was the reason why they have not, why ambulance was not there.
okay. Sir, there is a complaint that there is no proper health facilities in the South Goa District Hospital. What do you say on that?
We have been always complaining. As a chairman of the insurance committee, I had taken the doctors to task. I had to ask them one question. I said, if you being a doctor, are you happy with the facilities? I asked her the simple question. So she said, no, this, that. I said, see, District Hospital South Goa lacks services for the last 2 years. And we have been continuously raising it in the assembly. And the minister has been promising us that he is going to give more preferences to South Goa District Hospital. But I feel still we are lacking. Emergency service on kind of casualty in Bharat Dotor Sudanai. We have been even talking of Dr. Eddie, who is now retiring. After him, there will be nobody there. Either the extension in Durum Potalo, Nanzalari, Amko Tras Satatika. This is the situation there. Doctor Nai, Magi staff Satna, host Satnai. Every time we are, our assembly continuously उलयता हांव दुसऱ्या खबर हांव सांगना तुका continuously मागोता better facilities for district hospital. So I feel that we will now after this I will write again to the. By the way, I've been continuously writing to the minister, to the chief secretary, to the chief minister. Facilities होणे हैं continuously. आता district hospital आता big issues आता of hospital, private hospital. So I don't know whether that will help or not will help. Ultimately, dot or nahi, ani kitna hai, ani dot or nahi, ani kitna hai. So private hospital we'll have to see whether it will help the people. Because when the private hospital gata, teka mandatory umke वस्तू जायो.
Okay.
So hospital गेले ते mandatory वस्तू लोका मेटली. So that we'll have to see whether private all in Institute of Medical Sciences or बरोबर institution दिपा दे. पण private institution ना दिपा जाए ना दिल जाले. So that we will have to assess now. After so many years, we are having a problem with the district hospital. Okay. The point has come whether we have to take or not a private party on board. But private party म्हणते बेस्टे हुई आस पाए ना.
Minister हंगा आपके एवढे डॉक्टर को बा मुद्दा काही ना प्रॉब्लेम ना how it is.
So that सांगूंगा पटने. Ground reality as a hospital, he has to protect the name of the JMC and the auspicious. But ground reality, दोतोर आनी जाय आमी मोगे रेस करता असेंब्लीतूं की आमी हॉस्पिटलान दोतोर नाय आनी कितें आमी मोगे रेस करताय वी आर रेजिंग इट तो ना कित्याक तेका एज अ मिनिस्टर ही हॅज टू प्रोटेक्ट जीएमसी नाव हितू वर्सां जीएमसी पेड्डे जाताली जीएमसीची कितू एलिगेशन जाताली जीएमसी नाव पेड्डे जाताली न्ही पेड्डे कोत्ताले लोक पयलीं म्हणटाले की ऑर्गन काडटाय म्हणून तूं जाणा फेसबुकाचेर आमगे आहाय ते कितें उलयताले ते ऑर्गन काडटाय आनी कितें काडटाय बेश्टें कितें उलोवप आनी नांव वायट पेड्डे करप दोतोरां इवन हांवें रेज केला इश्यू दोतोरां मिनिस्टर सांगिलें हांवें वचोन बेश्टो तेंका सस्पेंड करून नाका तेंगे मॉरल देंवता सिनियर डॉक्टर्स आसता ड्युटीचेर तूं नेना सिट्युएशन कितें आहा तें सिट्युएशन इज प्रॅक्टिकली इम्पॉसिबल आतां तूं जाणा हॉस्पिटल यू नो वॉट इज द एडमिटल इन द इज वॉट इज द काउंट टू द फूड काउंट पडे आहा तो तूं चड जालो ते हॉस्पिटलान प्लेस ना उबो रावपाक दोन नर्सो आख्खे वॉर्ड 2-3 नर्सो आख्खे वॉर्ड थंय दिस इज द सिट्युएशन हो मिनिस्टर फ्रॉम हिज साइड ही हॅज टू प्रोटेक्ट ही हॅज टू से डॉक्टर्स आर ही हॅज टू से एवरीथिंग इज देयर बट पेशंट एक ओके एक दीस पेशंट आसना आतां पास जाले काय ना पेशंट उणी जातले आतां सीजन पीक सीजन मागीर पास जालो काय ना ते डेंग्यू बेंग्यू सगळे केसीस काबार जाल्यो ते मागीर उणी जातले So all this has to be taken care, and then we can't take the minister or something to task. Practically, atpu my situation bore ha. The hours kiti ahlole. Let's compare what it was in 10. Now we are complaining. आम्ही आता हेमात्ताय. आता आम्ही इलेक्ट्रिसिटी डिपार्टमेंट आता इतू वर्ष काम केला. आता एक कॉन्स्टिट्युएन्सी एक क्रेन आहा म्हणटा म्हणा मिनिस्टर. आम्ही क्रेन नासतना काय नासतना काम केला. ती सर्विस गेली. So now I would request the government to give more facilities whatever possible. Who is the budget and who is the push only one thing in the that playing of budget for right purposes is very important.
सर आता तुम्ही म्हणले की तुम्ही खूपशे लेटरा बरयले टू द चीफ मिनिस्टर टू द हेल्थ मिनिस्टर बट why action have not been taken?
This is a good question. It is easy to speak. From the time it has started to now, there have been a lot of significant changes. So it's taking time. We want so much. We want this much, but they give this much. So always the ruling side, always the minister has the issue of what to give, how much to give. So he's doing it, but then that is not sufficient. More stress has to be paid to give more things, but there is not that he is not doing it. It is following the system. No doubt, I'm the best of services there. But at the same time, we can't forget what was it 20 years back. I know what it was. And I am one of the person who goes almost every day to JMC, District Hospital of Pune town. JMC almost every day. Even today morning I went to JMC. I was with Dr. Tiwari in the morning. I took a kidney patient to at 11 o'clock. So I know practically what it is, what are the problems, what everything I know by heart. Makani kone explain kurba naga kiti ha deune. Sogli issue am raise karita hai, but then it's taking time. I wish more money is spent and I wish more services are given to people. Actually, I appreciate the service of everybody there. Doctors, nurses, barik काम करता. सगळ्या काम करना थोडे काम चालू आहे बट जे काम करता ते यू मस्ट सी हांव आख्खी रात भर देखून जीएमसी रावलो आहा फूल नायट रावलो आहा पेशंटा लागून आय नो वॉट इट इज सो एनीवे I wish that better sense prevails and we get more services. No doubt. आमगे ही फायट चालू दवरपा जाय आनी वस्तू घेवपाक इतली फायट चालू जाता तितली आनी चड जातले.
सर डू यू पर्सनली थिंक that गोंयान डॉक्टर कमी आसा?
Yes, I must say that qualified doctors or specialists, super specialists, कमी है दादा. I want to tell you also one thing regarding these doctors. I was one of the person who was always fighting for their salaries. I was always fighting for the last 10 years. I've been fighting with the assembly. आता हे गव्हर्नमेंटान तांकां सॅलरी मातशें इन्क्रीज दिल्या चड दिलो ना.
Who?
Senior residents, not senior residents, super specialist म्हणजे senior doctors.
Yeah.
HODs बी तांकां सॅलरी आतां मायज केल्या.
Okay.
ते देखून 10 वर्स झोगोण चीफ सेक्रेटरी केसो दिनालो. चीफ सेक्रेटरी म्हणटालो आपणागे सॅलरी तेंच्याकूयच्यान चोड काय म्हूण. So I'm just bringing to notice how we have been fighting for years together for GMC, for doctors, for everybody. I'm happy now the position is good of the GMC as well as the district hospital. कोण म्हणपा ना तुका GMC वचून बॅड ट्रिटमेंट मेळटा कोण म्हणपा ना तुका. प्रॅक्टिकली लोकां कडेन तेश कोन कंप्लेन करपा आसले. ते कंप्लेन केले बगर तें the world doesn't come to a circle. It would have gone AY. Because to come for a circle, we are there. Those people who are complaining, but no doubt facilities have improved. I would personally feel that more facilities we give, I would be happy.
Okay, so thank you. Yes.